COVID-19 pandemic has had a huge impact on human relations, communication, healthcare structures, and economic situations of persons, families, and societies. The virus spreads easily and can cause severe and even fatal disease. The current pandemic seems to increase inequalities in societies and between countries. While medicines have shown to be of no significant effect or having only a supportive role, vaccines are the only solution to get rid of this worldwide burden. The WHO and other bodies have emphasized the need to promote equity between countries and to establish international cooperation mechanisms to fight against the pandemic. Promotion of equity is a key factor for a successful battle against the pandemic, both internationally and within societies. The Council of Europe's Committee on Bioethics wanted to participate in the discussion concerning pandemic and vaccines based on the Oviedo Convention, the first binding international document concerning the rights of patients and ethical principles in biomedicine. Its third article states that parties shall take measures to provide equitable access to healthcare of appropriate quality. Also, other Council of Europe instruments emphasize human rights and fundamental freedoms, such as the right to life and the right to the protection of health. While at least in the beginning of production of vaccines there is shortage of them, and therefore a need to prioritize groups that have highest risk to get severe illness and transmit disease to others. However, it is also necessary to ensure that each person in those groups will be able to receive a vaccine without discrimination. In its statement, the DH Bio emphasizes the need of ensuring equity in access to vaccination and to draw attention to population groups that usually do not raise their own voices because of the vulnerable situation in the societies. It also calls for development of strategies to ensure appropriate support adapted to meet the needs of these population groups and to remove barriers to vaccination. The Council of Europe statement is composed of three parts. The first part deals with the practical strategies that should be put in place to avoid discrimination. The second part deals with the importance of strengthening transparency, information and communication as tools for building trust and ensuring that every person for whom the vaccine is indicated is provided with a fair opportunity to access vaccination. The third part deals with the essential requirement of the quality of vaccines and the professional standards that should be ensured for vaccination. To this end, the Council of Europe has long established a transparent framework for harmonization. Vaccination is a key element when returning back to normal life, schools, working places, social activities and meeting each other. Therefore, the equality in accessing vaccination is so important to most of us. This statement is directed to governments, but is accessible to everybody. We hope that it can be used in present situation, but also later if needed. The DH Bio wishes that this statement reaches those who can benefit from its content.